Thank you for the opportunity of being here. As you know, I'm a surgeon. I practice in Redding, California, where Redding Medical Center, the former Redding Medical Center, is located. At the in 2000, in late 2002, there was an FBI raid on Redding Medical Center to obtain records for one of the cardiologists, Dr. Che Moon, regarding multiple surgeries that were suspected of being unnecessary. Subsequent investigation, which included a grand jury in Sacramento, revealed that over 700 almost 700 patients with normal angiograms had undergone probably unnecessary surgery. 69 of those patients had died over a 5-year period. I was actually QA director at the time, and I really felt horrible about the events that happened. With the fullness of time, it became apparent that the events that did happen happened because a staff cardiologist, Dr. Moon, was able to systematically avoid peer review within the hospital structure. And his cases really never came to the attention of the peer review committees that were set up and established within the hospitals. Eventually, physicians within the community, 2 physicians within the community, as well as a whistleblower patient, finally brought attention to these events to the FBI, resulting in the raid. Dr. Moon and Dr. Viali Vasquez, who was the head of cardiac surgery at the time, subsequently have lost their licenses and are no longer in practice. Almost $500 million was paid out by Tenet Corporation to settle civil and criminal claims related to these events. A couple of years ago, Dr. Frank Sabat and Dr. Gerald Rogan, who I think you're going to hear from later, approached me about an analysis of the events that led up to the catastrophe at Redding Medical Center. I was surprised to learn that there was never any systematic governmental investigation of the events that led up to this, and so we undertook, based on public source records, our own report on the events that led up to this in the hope that, that eventually these types of events can be presented in the future.
Who's we?
Myself and Dr. Rogan and Dr. Sabat. We're all, Dr. Sabat was an intensivist practicing at Redding Medical Center, and Dr. Rogan works with the regional Medicare office in the area. And we submitted the report. Dr. Sabat has a connection with with Senator Grassley in the United States Senate, and we submitted the report in the summer of last year. Essentially what we found was that the events at Redding Medical Center were catastrophic, but really an extreme example of a common problem, and that is that peer review is performed ineffectively. Okay, we did not know that the Lumetra Group was working on a report also on this, but we reached essentially the same conclusions that they did, and we made the same recommendations to the Senate Finance Committee that the Lumetra Group has made to you, and that is that peer review conducted within the hospital setting is inherently ineffective. We believe that this is because of the human factors involved. In hospitals, when I have a case that goes bad, I have to sit before the surgery committee. But everybody at the surgery committee are people that I know and I have known for years. When they leave town to go on vacation, I take care of their patients. Conversely, when I leave town, they take care of my patients. Okay, so as a result, people tend to think twice about making an adverse judgment against somebody else. And really that's where the rubber meets the road. It's the doctor-to-doctor interaction in these committees where the judgments are made. Okay, before the 805 reports are filed, before this goes to the medical board, before this goes to the medical executive committee in the hospital, the doctors at the committee have to sit down and say, yes, this was a bad event. And that, we think, just simply doesn't happen. We have data to support that. We looked at the National Practitioner Data Bank, which is, as you may know, a federal repository of information regarding malpractice judgments and judgments in hospitals, judgments by hospitals and peer review committees about privileging. Anytime a malpractice judgment is made, either by settlement or by court verdict for any amount, a report is filed with the National Practitioner Data Bank. Similarly, whenever a hospital files a report restricting somebody's, or whenever a hospital makes a judgment to restrict somebody's privileges, again, a report is filed with the practitioner data bank. We looked at public access data files from the data bank which summarize different types of events, and we really found a wide range of different events that resulted in reports to the data bank, ranging from simple errors. For example, an accident at surgery that results in injury to a bile duct or something like this, all the way up to essentially criminal acts, exploiting patients for monetary benefit, things of this nature. These are all summarized. We looked at the ratio of actions that were reported by medical board, or I'm sorry, by hospital administrations, to the ratio of reports filed by malpractice as a result of malpractice actions. And what we find is the ratio is 8 to 1. In other words, for every one event reported to the data bank by a hospital, there are 8 reported by malpractice attorneys. And we're talking about a large number of events. We're talking about thousands of these events per year. And so we believe, based on that, that hospitals are not dealing effectively with events as they come up.
Okay, thank you.